Knock knock. Hello, hello. How are you? My name is Nazar Tambolan. I'm your nurse for this to discharge you today. And tell me your name of their birth. Okay. And then we have your spouse with you as well. All right. So yeah, how you feeling? How you feel today? Better? Yeah, when you come over here the last time, your blood pressure is really elevated. It's 188 over 120. It's already high, and they call it hypertensive crisis. And the normal blood pressure is 110 over 70, or we keep it at 120 over 80. So the high blood pressure, can damage the body organs such as your heart, your brain, and your lungs, and the your vision as well. So when you come over here, seems like you already have a symptoms that you have a headache, vision change, confusion, chest pain, shortness of breath. That's a when you have a high blood pressure symptoms, high blood pressure. Well, to control your blood pressure, seems like the doctor prescribed you with two medication. Yeah, which is Leprosor, Metoprolol tetrate 50 milligram daily, and Gestrel lisinopril 10 milligram daily. You may question why do you have a two blood pressure medication prescribed? Yes, each medication is a very different function. It's very common for unnecessary uh, doctor prescribe it for the patient. It's because one blood pressure is not enough uh, to control blood pressure. Each medication works differently. Like lisinopril is relaxing your blood vessel and protect your kidney, and leprosol metoprolol slow your heart rate and reduce the heart pumps and decrease workload of your heart. The important things about the taking the blood pressure is make sure you check your blood pressure first. You have any machine at home, and you can purchase them from the store and put them, and maybe Miss JD can help you, and if so that you can monitor your blood pressure, how high your blood pressure is daily, especially before you take it, because the certain number that you when it's too low you don't want to take it, and gonna going down. But right now seems like you have a high blood pressure, and then you can take the blood pressure. And lisinopril common side effect is dry cough, dizziness, and especially when you start it, headache. If you feel dizzy, sit or lie down and raise slowly, especially when you getting up, raise slowly, because you can be dizziness and fall. So uh, and also lisinopril can cause swelling on the face and lips and tongue, and they call it angioedema, and trouble breathing, severe dizziness, and fainting. Things that need to watch is when you take the lisinopril is follow low sodium diet, and be careful with the potassium rich food or supplements like banana, salt, and salt substitute. Lisinopril can increase the potassium level, and maintain healthy weight and activity. Stay hydrated is important. Lopressor metoprolol 50 milligram daily to treat hypertension and heart rate, pulse, and take exactly as prescribed. Take with food or right after meals. Take it at the same time every day. Do not stop suddenly. Stopping suddenly can cause serious heart problem. Call your doctor when you have experienced very slow pulse and less than 60, fainting or severe dizziness, shortness of breath, swelling in the feet or legs. Maybe they can make adjustment with your medication. And metoprolol can mask sign of low blood sugar, hypoglycemic, like uh, fast heartbeat. You should rely on checking your blood sugar regularly instead of just the symptom. Check your blood sugar. And when you come over here, seems like your blood sugar is elevated, is above 600, and this one is the 600 is sounded when sugar high increase urination and hunger and thirst. And diabetes mellitus can lead to life-threatening condition like brain and organ function can be affected. They call it hyperosmolar hypoglycemic state when it's above 600. But this can be modified by their lifestyle, eat properly and medication. And common symptoms of the hyperglycemic is extreme thirst, frequent urination, confusion, and disoriented blurred vision, weakness and fatigue, and headache. The blood sugar, normal blood sugar is between 70 to 90, or pre-diabetic is 100 to 125. Okay. Constantly high blood sugar can damage your blood vessel and organ, leading to heart disease and stroke, kidney failure, nerve damage, neuropathy, and vision loss, poor wound healing. To help control your blood sugar, your doctor prescribed you today with the medication called metformin glucovage 500 milligram. This medication, metformin, will help you control your blood sugar by increasing insulin sensitivity, improving how the cell respond to the insulin. Will decrease your glucose production in the liver and decrease intestinal glucose absorption. How to take metformin? Take it with food, take it at the same time every day. Do not skip dose and do not chew. Common side effect is nausea, diarrhea, upset stomach, extreme tiredness, weakness, and muscle pain. Feeling cold and dizzy and lightheaded. Check your blood sugar level regularly. If you don't know how to do it, I'll show you later. I can demonstrate it, and you can demonstrate to me back so that you can know how to keep your blood sugar, and then also write it down in diary, so that you can show your doctor, what is your routine level, your normal. And call your doctor when your blood sugar consistently high, severe vomiting, or diarrhea. Hold your metformin. Usually they hold before CT and with contrast surgery. And also before you come to the hospital, seems like you have a symptom hypothyroidism, your thyroid gland producing low thyroid hormone for metabolic growth and development. And you also have a GERD, stomach acid flow back up into esophagus and acid reflux. Medication, you have a medication, a Synthroid, levothyroxine, 100 microgram daily. And make sure you take it on empty stomach when you take levothyroxine, 30 to 60 minutes before breakfast, and drink with water at the same time every day. Report to your doctor if you have inflammation and thyroid storm. Do not skip any dose, and also they're gonna be follow up to check your thyroid level, okay, in the lab. And you're also taking Protonix ethylpentoprazole 40 milligram daily, and this medication will help with the GERD and where the stomach acid flow back into esophagus, and will reduce stomach acid. This can cause kidney problem or new worsening of lupus. Tell your doctor if you have a dizziness, irregular heartbeat, jittery, muscle cramp, muscle spasm, cough, urine less, or blood in the urine. This medication can cause diarrhea, watery or bloody nausea, vomiting, or weight loss. All right. Any question? Do you have any question? And for precaution, always wash hands and monitor your blood pressure, and take it when empty stomach. I hope you know all of this. Thank you.